Suggestions for Public Healthcare Challenges for the Development of Public Healthcare in Korea. Na Soon-ya, Chairman of the National Health and Medical Industry Union. The establishment of Sungnam Citizens Medical Center is very significant in the history of public medical expansion movement and public medical development in Korea. The first is that while the government gave up the expansion of public hospitals and tried to reduce them, labor and civil society stepped up and established public hospitals on their own. Rather than expanding public hospitals that were far short, the government tried to sell them to the private sector or entrust them to the private sector for deficits, and forced them to reduce their functions and pursue profits. The establishment of Sungnam Citizens Medical Center reversed this trend and created a new trend to expand public hospitals. The second is that public hospitals were established through the Residences Ordinance movement. Through extreme irresponsibility and obstruction by local governments and local councils. In order to protect the health and life of local residents, labor and civil society have created a history of actually establishing public hospitals in the wilderness, where there is simply nothing, transcending economic and political interests and barriers to laws, systems, and budgets. Third, the public as an alternative to resolving the medical gap and the medical gap caused by the closure of private hospitals. He established a hospital. In Korea's medical system, where more than 90% of private hospitals are distorted by oversupply and excessive competition, the possibility and precedent of resolving the medical gap and medical gap that are inevitably caused by the closure of private hospitals are created through the establishment of public hospitals. In this regard, the 18 years from the closure of Inha Hospital and Sungnam Hospital in Sungnam to the establishment and operation of Sungnam Citizens Medical Center were a significant turning point in the expansion and development of public medical care in Korea. The COVID-19 incident showed the bare face of public health in Korea, and it proved that expanding public health is a stepping stone to protect the health and life of the people from medical disasters. The key to solving economic and social disasters, and a solid security for a healthy and safe future society. Therefore, the expansion of public health care is a task of the times that cannot be delayed further. In order to realize the national responsibility system for essential medical care, it is necessary to create a miracle of 100% completion by 2025. With the task of designating and operating regional responsible medical institutions for each of the 70 medical rights at the core. Public hospitals should be created in medical rights without public hospitals. And private hospitals should be publicly acquired or converted into public participating hospitals in medical rights that are feared to be oversupply and over-competitive due to many private hospitals. Although there are public hospitals, the government should push for projects to expand public hospital facilities and strengthen functions in medical treatment rights that are difficult to provide quality essential medical services. Obstacles to the expansion of public hospitals, such as preliminary feasibility studies, excessive local expenses, and operating expenses deficits, should be boldly removed, and stepping stones to the expansion of public hospitals such as laws, systems, and budgets should be secured. The answers are all contained in the case of the establishment of Sungnam Citizens Medical Center. Labor and civil society should step up, and the government, local governments, and local councils should step up. The government's plan to expand public health care should be implemented, not just a verbal plan. And the public should move and make public opinion move so that the public health expansion agreement signed by the Health and Medical Union and the Ministry of Health and Welfare on September 2, 2021 is actually implemented. With the establishment of Sungnam Citizens Medical Center as a starting point, we hope that the day will come soon when all citizens can receive high-quality essential medical services in their areas.